Good morning, everyone. It's Casey coming to you this morning live from HonorHealth Shea. And today I have Gina, who's going to be going over some breastfeeding, what to expect here in the hospital, and way to stay kind of safe and keep your baby safe in regard to feeding your baby due to COVID-19 and kind of what we can be doing to prepare and plan for that. So thanks for coming on today, Gina. Gina's been a nurse here for 15 years, and she's been one of our IBCLC certified lactation nurses for about 5 years at Shea. So if this is not your first baby, chances are you've probably met her before and seen her up on the hospital, or you might have met her doing some of our education online. But today I'm going to go over a few updates as far as our COVID-19 policies here at the hospital. And this is again for both Shea and our Osborne campuses. And these are effective as of today, May 19th. But they are, of course, subject to change as we're continuing to learn more about this virus and what we can do to keep all of our patients and staff safe. So kind of keep in tune with us, keep checking back. We'll keep you updated as far as what to expect when you come in for the hospital, okay? But as of today, we've switched our screening for our pregnant moms who are coming in. So now if you're coming in for a scheduled delivery, so that's a scheduled cesarean delivery or a scheduled medical induction of labor, we're going to go ahead and call you about 2 to 4 days prior to your planned delivery. And we're going to have you tested. We're actually going to call you probably a little bit before that. But you're going to go ahead and get tested for COVID-19 about 2 to 4 days prior to your expected delivery day. And that's going to be about 24 to 36 hour turnaround. So we'll have those results by the time that you are expected to deliver, okay? So we'll call you, and then at Shea, you'll come on in and get the test here. And then at Osborne, we have the drive-through screening still. So whichever campus you decide to deliver at, that's how you're going to go ahead and get tested. And then we are asking that once you are tested, go home, quarantine until you come to the hospital, just to try to minimize your potential exposure after that. So that way those results that we have are as current and reliable as possible, okay? For patients that come into triage, symptomatic, so if you're showing any signs of COVID-19, we're going to triage you and screen you, and then your OB will determine what type of test, if any, needs to be ordered. We have the rapid in-house testing, or we have the send-out. So that's going to be a discussion when you come in for delivery or for any other reasons while you're pregnant with your OB provider, and that's if you're symptomatic, okay? Currently, we've switched, and so now asymptomatic labor and antepartum patients will not be tested, okay? So that's super important as far as your face mask. So please continue to wear them throughout your hospital stay. Always have it on when you're in your room, definitely when you're leaving your room to do a little walking. Obviously, when you're eating and sleeping, you're not going to want to have it on, so that's okay. But if you are in the room, go ahead and keep it on, just because you don't know when staff are coming in and out, and you don't have to worry about kind of fussing with the ties at the last minute. Today, Gina and I are distancing 6 feet apart, so we do have our masks off, but when you do come into the hospital, all of your staff will have their masks on at all times. When you see us at the nurses' stations as well, we're going to continue to have our masks on, okay? So those are the big changes, just in testing, really. And like I said, if you have any questions about what we've been doing before this, go ahead and reference back to some of our previous videos, and we can kind of get more into that in those. But the biggest change is that if you are having a scheduled delivery, that we can go ahead and test you ahead of time now. And if you're asymptomatic, we will not be currently testing, okay? But let's get to breastfeeding and how you're going to feed this sweet little baby. That was one of my favorite things doing with my son. So as far as COVID-19 and some of the precautions that we should be doing with our babies there, first we're going to talk about if we're positive. So what should our mommies be doing if we do test positive for COVID-19 as far as breastfeeding our baby?
So if the mom tests positive for COVID-19, we will be separating the mom and the baby. And so the mom will start pumping immediately as soon as possible after delivery. You may bring your own pump in from home if you would like. Otherwise, if you don't have a pump, we will provide you with one. And so when you're pumping, you're going to want to make sure that you get a good seal with the flange onto the breast. That way you get a good seal. And you want to make sure that your nipple is not rubbing on the inside of the flange. And you want to pump as frequently as you would feed the baby. So you would normally feed the baby between 8 to 12 times in a 24-hour period. And so you would want to be pumping that frequent every 2 to 3 hours. And that will help bring your milk supply in. Don't get discouraged if you don't get anything out right away when you're pumping, because the pump does not adequately get colostrum out of the body, but what it does is it stimulates your body so that your body knows how much milk to make. Then you'll actually see a lot more output as your milk starts coming in. Anything that you do pump out, you can obviously save. You can either choose to save it and give it to the baby, or you can pump and dump and then choose when you're ready to breastfeed to put baby on the breast.
And should we be wearing our mask while we're pumping?
Definitely wear your mask while you're pumping because as you're pumping, you're going to be looking down at your breasts. You're going to be breathing on your pump pieces. And you want to have really good hand hygiene, washing your pump pieces after every use, washing your hands before and after pumping, and making sure that you clean your pump piece as well.
Okay, great. And if we do choose to breastfeed baby in the room, then we should definitely still follow strict hand hygiene, wash our hands before feeding baby. Definitely wear your mask if you're going to be nursing your baby. And then I would suggest definitely having your support person do all other care for baby. So you're just going to be there for feeding mama if you are COVID positive and you choose to do so, if you're not going to be pumping. But it's going to be really, really important that you wash your hands before you touch baby, before you bring baby to the breast, and have your mask on at all times when the baby's close to you. Okay. And then just kind of some basic breastfeeding as far as keeping everyone safe and healthy. What about cleaning our pump pieces if we are pumping and we are COVID positive, or if we're COVID negative when we're pumping? How should we be kind of cleaning our pump right now to keep everyone safe?
So cleaning your pump pieces, you're going to want to use soap and water after every single use, especially anytime that you get any breast milk into the pump pieces. You want to take them all apart, take all of the pieces apart, make sure that you take the little flanges off and clean them all with soap and water. Then every day, we have these little quick steam sanitizer bags. And so you can put all of your pump pieces along with 2 ounces of water in the microwave for 2 minutes, and that will sanitize your pump pieces. And you can do that daily. And these little bags are useful for 20 times. So you can use this one bag for almost 3 weeks.
Okay, awesome. And I think we kind of covered this, but one of the questions that we've been getting a lot of is if I am COVID negative or if I'm not tested, should I be wearing a mask while feeding my baby?
It does help because as you are trying to latch that baby onto the breast, you are looking down and breathing on your baby. So it certainly would help to help prevent any particles from your mouth and your nose to get onto the baby. But also, keep that good hand hygiene with you and with baby at all times.
Right. And then Gina, while I have you here, can you share with us kind of what to expect when you are here in the hospital as far as breastfeeding your baby and some of our kind of little basic tips and tricks that you can share with us today?
Sure. Well, in the first 24 hours, your baby might be really sleepy, it might be really spitty. Your baby might not be the best feeder in the first 24 hours. So if your baby is full term and a healthy newborn without any problems with blood sugar, then we're just going to feed your baby as much as your baby will tolerate. You want to try to put the baby to the breast anytime your baby is giving you the feeding cues. So when your baby starts sucking on its fist, sticking the fingers in the mouth, rooting around, opening that mouth, turning the head, and smacking their lips, that's your baby's cues of saying, I'm hungry. If you put that baby to the breast right when you see those feeding cues, it's going to be much easier to latch your baby. So you want to get that baby onto the breast as quickly as possible, and your baby will be most patient and cooperative at that time. And so I don't ever recommend scheduling feedings, but I recommend putting baby to the breast frequently. By day 2, by day 3, you really should be getting that 8 to 12 feedings in a 24-hour period. So if you feed your baby every time they give you the feeding cues and you write it down, you'll see a pattern that will start to develop over a couple of days. And if you see long stretches in between feedings, then make sure you are waking your baby up more frequently and getting that baby to the breast more frequently.
And then what should we be watching out for? How do we know if baby's kind of feeding effectively? Should we be logging anything in addition to their feeds?
Definitely be writing down all of your feedings and all of the pees and the poops. When we watch for baby to pee and poop appropriately, that also tells us that baby is getting enough breast milk. We'll also be weighing your baby each night in the hospital, and that will also tell us how well your baby is breastfeeding. So we want to get at least 1 pee and 1 poop in the first 24 hours. Anything more than that is bonus. So that is the minimum expected, is just 1 pee and 1 poop. And then after that, by the time your milk comes in around day 4, day 5, you'll start seeing 6 to 8 wet diapers a day and anywhere between 2 and 10 poopy diapers. You want to get that baby to the breast frequently, and the weight loss on baby should never exceed more than 10%. You'll know breastfeeding is going really well if they're peeing and pooping adequately, getting to the breast frequently, and they've regained their birth weight by 10 to 14 days.
That's all good info. What should we be doing, or is there anything that we can be doing as far as supplies that you might suggest that we can be kind of getting for home use and getting ready? Do you recommend having a pump on hand before delivery, or kind of with these times? And
if your insurance company will give you your pump now, try and get your pump now as soon as possible, because you don't know if you're going to be struggling with breastfeeding in the beginning. And if you are struggling with breastfeeding, or if baby needs any sort of additional support in the beginning, then we will have you start pumping as soon as possible, just for that extra stimulation. And so having your pump available is great. Also, I highly recommend, if you are going to be pumping, or if you're COVID positive and you're separated from baby and you're pumping frequently, it's really great to have a pumping bra that holds the pumping pieces onto you so that you're not, and keeps that good seal on the flanges so that you're not having to hold them with your own hands. It also helps you to relax better, and the more relaxed you are, the better your milk is going to flow, and the more relaxed, the more milk you're going to get out when you're pumping.
What about any breast care supplies, any creams that you might recommend for the hospital or for home, or what do we have here in the hospital?
Here in the hospital, we supply lanolin. Lanolin is really great for your nipples to keep them from getting dry and chapped. They're going to be used more than they've ever been used before. So this is going to be really helpful. It's also really comforting when you're getting a little bit sore as well. But it's really a key to get a good latch, and that will help to prevent the soreness.
Okay. And even with COVID-19 going on, do we have lactation staff, or who's here to support us in the hospital when we're here breastfeeding?
We do. All of our nurses have some breastfeeding training, but we do also have IBCLCs, or lactation experts, who will come and see the moms in the hospital. Right now, our outpatients are on hold right now, but as they come back online, we will let you know.
Okay. And we do have a phone number that we'll pass out in just a minute for everyone at home. So you can call us with your questions. You can call us here at Shea or at Osborne. Both campuses, it doesn't matter where you deliver. You can call either location to go ahead and get help with your breastfeeding. Okay. And then one last question that we get frequently. Should you bring your pump with you to the hospital, or do I leave it at home? What would you say?
You can bring your pump if you like to. We do have pumps available. We have the Medela hospital grade pumps, and we have those available. We also have those available for rent, should you need them. Should you need a pump and you don't have yours yet. We do have those, and we can rent them on your discharge, and your discharge nurses can take care of that.
Okay, perfect. Alrighty, so then for our resources at home, I just want to share with you real quick our lactation phone numbers before we wrap it up today. So for our Shea campus, our phone number is 480-323-3536. And over at Osborne, their phone number is 480-583-2946. So that's how you can get a hold of us if you need any help once you're discharged from the hospital. All right. Well, thanks, Gina. Any other little tips and tricks?
Yes, those phone numbers, you're going to leave a message, and that lactation nurse will then call you back. But if you need help 24/7, the state of Arizona has a breastfeeding hotline, and that state of Arizona breastfeeding hotline is 1-800-833-4642.
Awesome resources. Okay, guys. Well, I think that'll wrap it up for us today. Stay kind of in touch, and we'll be keeping you updated as when we're putting out more videos and keeping you safe. We'll see you soon. Bye-bye.